We've made a lot of progress. Our strategy is moving along well. Now we have tested almost 40 million people. By so doing, we show cases, 99% of which are totally harmless.
As President Trump downplays the threat posed by the coronavirus, the U.S. sets new records of over 50,000 daily infections as the latest death toll surpasses 130,000. Hello and welcome to Inside America with me, Ghida Fakhry. Several states across the U.S. have scaled back or reversed their reopening following the surge in new infections, with Arizona recording over 100,000 new cases in a single day. More than 20 states have set record highs for the average of new cases over the last 7 days, with a sharp increase in new daily infections in more than 40 states, including Florida, Texas, California, and Georgia, which were among the hardest hit. And while President Trump maintained that if the U.S., quote, didn't test so much and so successfully, there would be very few cases, the top infectious disease expert, Dr. Anthony Fauci, gave testimony to lawmakers in which he contradicted the president's assertions that the pandemic is under control.
I'm not satisfied with what's going on because we're going in the wrong direction if you look at the curves of the new cases. So we've really got to do something about that, and we need to do it quickly. Short answer to your question is that clearly we are not in total control right now.
And as health officials in the U.S. continue to stress the importance of wearing masks and social distancing, President Trump held a large rally in South Dakota to mark Independence Day without following the recommended coronavirus guidelines. Thousands of supporters gathered at Mount Rushmore with no social distancing or masks required. So is President Trump putting his own political interests ahead of Americans' public health? For an in-depth look, I'm joined by Steve Cortez, spokesman for the America First PAC, the only official pro-Trump super PAC. Steve Cortez, the president held his 4th of July rally with no regard for the federal health guidelines of wearing masks in public spaces and also keeping social distance. And since then, he has said that 99% of cases are, quote, totally harmless. Is this a president who is in denial, or is this a calculated, deliberate attempt to mislead the American public?
Well, Ghida, I would say it is neither. In regards to the July 4th celebration, actually on the 3rd of July, in the case of Mount Rushmore, masks were recommended, but it also, of course, was an outdoor celebration. And we know the science and the data indicate that outdoor gatherings are not high risk. In addition to that, the state of South Dakota itself is simply not a high-risk population. It's a place that has been largely unaffected by coronavirus, thankfully.
Well, let me just tell you, let me just interrupt you here, because the CDC guidelines say this. They say wear cloth face coverings in public settings where other social distancing measures are difficult to maintain. And yet there was no social distancing in that rally.
As I mentioned, Ghida, masks were recommended. It's up to individual choice, of course, how people choose to behave. We're going to have another outdoor rally. And then, by the way, that wasn't really a rally. That, of course, was just an American celebration. That was not a Trump campaign event. He was there as president of the United States, not as campaign candidate Donald Trump. But there is going to be a campaign rally this upcoming weekend. It's going to be outside in New Hampshire, another place that is largely unaffected by coronavirus. And safety precautions are being put in place, including, again, as was the case in South Dakota, the recommendation that the participants wear masks.
But he is going completely against public opinion. He's out of sync with the majority of Americans on this. Just look at the latest Fox News poll, which says that as many as 80% of Americans favor wearing masks, and just 23% think it's a good idea for politicians to hold large rallies or political events right now. So why then is the president going ahead with them? There's obviously very little appetite, and that was quite well displayed in Tulsa when he held his rally there. Why is he doing this, if not for his own narrow political self-interest?
Well, Ghida, regarding masks, of course, the president was very clear just the other day in saying that he believes in masks and he believes that people should wear them. So he's not out of sync with the American public on that issue.
Well, he's not leading by example, though, is he?
In regards to the rallies, though, I think this is important. Look, it's up to individual choice. And I was not at the Tulsa rally, but I spoke to a number of people who were there. And they told me, for example, that the crowd was noticeably younger than is typical of a Trump rally. So a lot of people very smartly made their own decisions. People who are at high risk, generally the elderly, are probably going to choose and should probably choose to not attend large gatherings of any type, including a Trump rally. And again, I think the president counts on the American people and on their good judgment to make those kind of individual decisions.
When you look at the president saying that 99% of cases are harmless, does that help the American public know the severity of this? 8.5% of the 2.9 million cases in the US have resulted in hospitalization. That is hardly insignificant or harmless, is it?
Look, nobody said that this is harmless, particularly for at-risk populations. But when we
Well,
look
no,
at
the president
young people,
did. The president did, Steve Cortez.
When we look at young people, though, and this is the truth. When we look at young people, particularly children and teenagers, the risks are infinitesimally small. That is the absolute reality of this virus. Thank goodness they are not overwhelmingly vulnerable to the virus. And what we see in terms of the explosion in positive cases that we've seen in certain areas of America is that the age of those infected is also coming down demonstrably. That is really good news. We know that even the harshest of lockdowns did not stop the virus from spreading. There's an inevitability to the virus spreading. I think we have to accept that fact. But what we can do in terms of public policy is protect vulnerable populations, primarily the elderly, and also ensure that our healthcare system is not overwhelmed. That has not happened anywhere in America. Is that what the president is doing?
Well, he has now said that he is going to hold the Republican National Convention next month in Florida. We all know the demographics of Florida and how much of a vulnerable older population that state has. Never mind the fact that it's also seen a recent surge in cases. Why is the president intent on putting these populations at risk?
Well, once again, people will make smart decisions for their own health, for their own well-being. I, for example, am going to the Republican convention in Florida, but I'm relatively young, not as young as I'd like to be, but I'm young and healthy. I am generally not at risk. A lot of people are going to make, again, those smart individual decisions to attend, and there will be many safety precautions, a lot of masks, a lot of hand sanitizer. There are going to be precautions. But once again, I think we have to accept it is inevitable that the virus will continue to spread. It spread even during the harshest lockdowns, whether we look at places overseas like Italy and Spain or places like New York City. The virus will spread. We can't necessarily control that. What we can control is protecting vulnerable populations, primarily the elderly, again, and not allowing our healthcare system to be overwhelmed. That has not happened, not even remotely close. Even presently in places like Texas or Florida, which are seeing a surge in positivity, there is absolutely zero problem regarding the healthcare system. There are plenty of ventilators, plenty of ICU beds.
But isn't the role of leadership, though, in a time of major crisis like this, to persuade the public to act in a way that protects everyone? Just look at the case of Canada. They've encouraged the wearing of masks from the top down. They averaged, over the last week, 283 new cases, whereas the United States is averaging 49,000 new cases per day. Wouldn't it help if the President of the United States sent a different message to the American public?
Well, Ghida, I haven't looked at the numbers from Canada, so I can't speak to what is responsible for that lower rate there. I would suspect it has something to do with a lot less testing than is going on in the United States. But regardless, regarding the United States,
well, hold on. You say a lot less testing, and that is also an argument that the president has been using, but that has been completely cast aside by his own former FDA, the Food and Drugs Administration's commissioner, has said that more testing does not lead to more cases. It just shows that the situation is not under control.
No, well, I completely disagree. I mean, look, more testing will absolutely yield more positive tests. I mean, that's just the reality of it. Again, the spread of the virus to a certain degree is inevitable. I mean, we know this. We know this because even during the harshest lockdown measures, the virus still spread. So the virus will spread. We can't control that to a degree. What we can control, again, is protecting vulnerable populations and making sure that our healthcare system can handle those who do become seriously ill. And on that score, that's the most important score of leadership from the president regarding this virus, is how has the American healthcare system handled those who are seriously sick? And in America, the scoreboard, if you will, on the whole, has been fantastic for the president in this regard. The only place that performed very poorly was New York. York, and that's not because of the president, that's because of the dreadful decisions of Governor Cuomo forcing knowingly infected people back into nursing homes where they became, unfortunately...
You talk about a scoreboard, and let me just give you an idea of the latest poll numbers, which I'm sure you're very familiar with. They show that this messaging by the president is clearly hurting him, with a lot of voters. His support among white evangelicals, although still high, has dropped by 7%. So has his support among Republicans. Clearly, his strategy isn't working. On the other hand, many people would argue Joe Biden, his rival, is displaying the kind of conscientious, responsible leadership on this. Here's what he has been saying.
I'm going to follow the doc's orders, not just for me, but for the country. And that means that I am not going to be holding rallies. I am not going to be, for example, you all are here, but thank the school has put those circles around so we keep the social distancing. Everybody has masks on. As soon as I finish this, I'll put my mask back on.
So a very different approach by Joe Biden.
You know, here's what I would say. I think it's important to realize that we didn't elect somebody like Dr. Fauci or any public health official, for that matter, to be president of the United States. We elected Donald Trump. Now, the medical input is absolutely critical, particularly in a time like this of a national health crisis. But it doesn't mean that that's the only input. There are many considerations for our society. For example, the economic considerations, the educational considerations for children. There are many inputs. The medical input is a critical one, but it's not the only one. And given that, what the president has to do is take all of this input and determine what is best, what makes the most sense from a risk-reward basis for our country. And he has said, again, I have to reiterate once again, he has said that he believes in masks and he believes in people wearing masks. There's going to, for example, the rally this Saturday in New Hampshire, a mask will be given to every person who attends. So clearly,
well, he didn't say he believes in people wearing masks. He said he didn't have a problem if people wanted to wear masks. It's very different.
Right. Well, he believes in individual choice, and he trusts the American people to make smart choices. And overwhelmingly, the people are making smart choices. Those who are vulnerable, in general, are either staying in their own self-imposed lockdown or being extremely careful about the interactions they do have with other people. A lot of young people are choosing, very smartly, I think, also to re-engage in life, in work and play, and we hope school in a couple of months, because they are overwhelmingly not vulnerable to the virus. The president trusts the American people to smartly, intelligently make these kinds of choices.
But yet he is giving them information that flies in the face of all the accepted scientific data. You mentioned Dr. Fauci. Dr. Fauci has said the United States is admittedly losing the battle. Things have to change or they will only get worse. Still, the president seems to refuse this. This is what he says.
And the crisis is being handled. Some areas that were very hard hit are now doing very well. Some were doing very well, and we thought they may be gone, and they flare up, and we're putting out the fires.
Is the president really putting out the fires, or is he simply focusing on his re-election?
No, look, I think what he said is completely accurate. The places that were previously hardest hit, places like the New York area, the tri-state area of New York, New Jersey, and Connecticut, are now seeing a very low level of virus infections. And that, by the way, just makes sense. That is how viruses work.
But you ignore the other side of the reality, which is that over 20 states, in fact, far more than 20 states, have seen a huge uptick.
I'm not ignoring it at all. Once again, I'll say this again. The spread of the virus, to some degree, is inevitable. Even lockdowns did not stop the virus from spreading. We know it is going to spread. What is not inevitable, and what we can control, is who gets it and how does the healthcare system of the United States handle and treat those who become seriously ill. And on those scores, we're seeing enormous successes in the country. The healthcare system has not been overrun anywhere, even in New York City. It certainly is not overrun right now in Texas or Florida, places that are currently seeing a surge. That, to me, is the success of the president's strategy in controlling the virus to that degree that we can control it. And once again, we have to rely on the American people. We cannot shut our society down again. The president's been very clear on that, and the people will not obey it, even if he wanted to shut the society down again, which he does not. So what we can do is encourage people to make smart choices, which they're overwhelmingly doing.
But let's face it, President Trump also knows that his campaign for re-election is in serious trouble, and therefore he wants to get out and hold all of these political rallies and events to re-energize his base. I mean, look at the latest polls. It gives Biden an edge of 89% chances of winning the Electoral College, which determines the outcome of the race, compared to Trump's 10% chance. His chance of winning the popular vote is just 1% compared to Biden's 99%. Is this all about trying to change the tide, no matter what the cost might be?
Well, you know, when I hear those kinds of statistics thrown out, I have to smile a bit because it reminds me a lot of what I heard in 2016 when I was campaigning for his first election then, and of course I'm working very hard on his re-election now. But we heard that same kind of confidence, and really from a lot of people, almost arrogance and condescension, that it was a sure thing that Hillary Clinton would lose. We hear just that kind of confidence now from a lot of Biden backers. Look, I think the president is going to win this election. I'll be the first to say, though, that I think it's going to be quite a horse race. And when I look at the polling, and I do pay attention to polling, it shouldn't be our North Star. It shouldn't determine everything we do, but it's an input that's important for those of us involved in the re-election effort. And when I look at polling of battleground states, independent polling, it shows me that almost all of them are within the margin of error. And either Trump is narrowly up or Biden's narrowly up. That tells me that this race is going to be won in the next several months. It is hardly decided. And we on Team Trump have to work incredibly hard. We have to hustle and message. We have to act like we're behind. And maybe we are, maybe we're not. But let's act like it regardless, and sell our vision for America for the next 4 years to the American people.
All right, Steve Cortez, thanks very much for joining us.
Thank you.
While the Trump campaign faces criticism for politicizing masks, the recent spike in coronavirus cases has led to mayors and governors in several states urging people to wear face coverings. The Republican governor of Texas issued an executive order making masks mandatory in public spaces in counties with 20 or more positive COVID-19 cases. A $250 fine has been set for anyone caught not wearing a mask. Texas is one of the many states that have seen a substantial increase in infections over the last 2 weeks. Joining me now is the mayor of the city of Abilene in Texas, Anthony Williams. He was elected in 2017 and became the first African-American mayor in the city's history. Mayor Williams, the city of Abilene sent its citizens a few days ago an emergency alert warning that there was a 540% increase in COVID hospitalizations. What is the situation like now? Is it under control?
Well, Abilene, like our state, like the country, is facing COVID-19. Abilene has fared a lot better than most communities that are around us and are in the state. But we're really trying to be sure that our citizens are aware of COVID-19, and we're trying to, in a very effective way, disseminate that information.
And many cities in Texas, in fact, including Houston, Austin, and San Antonio, have been warning that their hospitals could be overwhelmed in less than 2 weeks. Do you share similar concerns?
Well, from the very onset of COVID-19, hospital beds has been a key indicator about severity. In Abilene, we've never been close to being at capacity, and currently we're not close to capacity either. So we've managed it fairly well, and we've done so because we're trying to be very, very proactive, very, very intentional in how we address and handle and respond to COVID-19.
And one of the things you did do was recommend that people wear face masks. But the governor, the Republican governor of Texas, Greg Abbott, has gone further. He's made the wearing of masks mandatory. Do you support this move?
Well, what we do, we came out prior to the governor's mandate, and I strongly encourage every citizen to wear a mask. In fact, in our due diligence, we spent 3 or 4 days engaging our business community and other stakeholders and putting together policies that we thought could mitigate the spread of COVID-19. And so I support our governor as well as other leaders in the country. My preference would be for recommendation rather than a mandate. But these are tough, unique times, and don't really lend itself to any sort of prepared handbook. So everybody's responding in the moment with the data and the way they think is best for the constituents.
But does it help when local, state, and federal officials including the president and officials at the White House, actually wear face masks?
Well, I think it's always important that you are an example. And so I can't speak for others, so I'll speak for myself. So when I'm in public, when I'm front facing, I have a mask. And so I always keep a mask on my person. I keep one in my office. I keep one in my vehicle because I want to always be prepared. And so that's a commitment that I have made, as well as my family and those who work with me.
The city of Abilene voted overwhelmingly in 2016 for Donald Trump. In fact, I believe some 80% of voters there supported him. The latest polls, though, show that a majority of Americans disapprove of Trump's handling of the pandemic. 56.3% disapprove, 39.6% approve. Are you surprised, and are you seeing similar trends in your city?
Well, we don't have any poll, or we have not conducted any poll in our community, but I'm not surprised by the current polling. I mean, we're living in unprecedented times, very unique times, and of course, a lot can change between July and November. I think if one thing the last election taught us is that polls can change, and polls are not always accurate.
They're not always accurate, but another poll here from Gallup puts Trump's approval rating at just 38%. Do you believe that the president still have the strong support of those voters who did support him back in 2016, given the way he has or hasn't handled this pandemic?
Well, and I, both from my purview of the governor of our state and also the president, very challenging times from an oversight of the state and also of a country. And our economy, I can't speak in regards to the national economy, but I can speak to here in Abilene. Our economy has really been affected, and a lot of things are important and or significant. I'm not sure what's more important than somehow someone was able to take care of their family. And so people are strained and they're stressed, they're worried and concerned. And that anxiety, really questions leadership at all levels.
But do you believe that states that chose to open too early are paying the price? Do you think that the government bears some responsibility in urging some of the governors to loosen their restrictions a little too early?
Well, I think everybody, not just locally, not just statewide, not just national, but the world is paying the cost for COVID-19. It's affecting all of us, creating a brand new norm. It's been devastating to all of us. And so in regards to paying a price, everybody is paying a price. And I think that those who open up early, recognize the significant effect it's having on the ability for families to take care of themselves. And so I think it's an attempt to be sure that we're responding in ways that we think are appropriate to help our families.
But what do you make of the often conflicted and sometimes over-optimistic messaging that comes out of the White House? Does it give Americans a false sense that this crisis has passed? Because the President of the United States said this just recently. He said, we're headed back in a very strong fashion. And I think we're going to be very good with the coronavirus. I think that at some point, that's going to sort of just disappear, I hope. What do you make of this statement?
Well, if you look at the job rates in June, significantly surpassing estimations, that's good news. In regards to the pandemic, it is so fluid. It changes not every week, but sometimes it changes within the week, and sometimes even within the day. It is constantly evolving. And although we have a lot of very intelligent people trying to provide insight and projections, nobody really knows because of the uniqueness of what the pandemic represents.
Mayor Anthony Williams, thank you so very much for joining us. Great pleasure to have you.
Thank you very much.
While many governors and mayors are desperately trying to stop the spread of the virus, it continues to take a devastating toll. The president, meanwhile, seems entirely focused on turning the electoral tide amid consistent polls showing him losing ground, including in battleground states, to Joe Biden. Trump knows he has an uphill battle ahead of him. While he has lost some of the support of his Republican base, he remains perfectly attuned to his conservative core base, white evangelical voters who make up a quarter of the electorate and tend to give precedence to religious precepts over scientific evidence. Trump is seeking to shift the debate away from the pandemic to the politics of religious nationalism, to the question of individual freedoms, to quote, a culture war, with a crescendo of bellicose rhetoric on the symbols of the Confederacy and their place in today's America, on the looming takeover of the country by, quote, the radical left. Trump's campaign message about the pandemic is simple. It is an overhyped crisis that requires limited intervention from the federal government, meaning Trump himself. No responsibility, no accountability, despite the colossal human and economic costs. And so, in short, not wearing a mask has become an ideological badge of honor for many Trump supporters, as the president continues to praise himself for doing, quote, a historic thing and saving millions of lives. But the grim reality is that the pandemic's death toll is already 20 times that of American casualties of the Afghanistan and Iraq wars combined. And despite the dire predictions, it is the new American war the president is fanning that could have the most far-reaching consequences in the lead up to and well beyond the presidential elections. Let us know what you think, but for now, from me and the entire team here in Washington, thanks for watching.